Our exploration of the self system begins with some fundamental questions. What do children know about themselves, and when do they come to know it? Imagine a toddler proudly announcing, I'm a big boy, or my name is Jeremy. While these declarations show a budding sense of self, Jeremy might not yet grasp his physical traits, whether he is heavy or slight, his personality, whether he is shy or bold, or his living conditions, whether his family is middle income or poor. Children's self knowledge evolves steadily through their childhood years. This development is linked with their cognitive growth and socialization processes, weaving a complex tapestry of self awareness that becomes richer and more detailed over time. Researchers have different beliefs about when self awareness begins. Some suggest that babies are born with an innate sense of self, while others believe that self awareness gradually emerges over time. Increasingly, personal processes are seen as playing a crucial role in this development. For instance, the ability of infants to imitate adults' facial expression is thought to indicate an innate sense of self. Studies have shown that even at just 3 months old, babies can recognize video images of their own movements. When presented with different images, sometimes reversed or upside down, babies could easily detect when the timing or direction of the leg movement they saw didn't match what they were doing. This suggests a remarkable early awareness of their own actions. Another fascinating example is the egocentric nature of infant searching behavior, which gradually shift to more environmentally influenced strategies. For example, if a 6 month old is taught to look for an object located to the left and then rotated so that the object is now on their right, they will continue to search by looking to the left. This behavior indicates that infants are beginning to understand their own separate existence, even if their strategies are still developing. Personal agency, or the awareness that the self has the power to cause things to happen, is considered a key indicator of self awareness. One of the early signs of this awareness is seen in how infants interact with toys and other objects in their environment. Research shows that the more sensitive and responsive the parents are, the quicker infants come to understand their own influence on the world around them. For example, a baby might realize that shaking a rattle produces a sound, and they begin to understand that their action can cause changes in their environment. This understanding is fostered by parents who respond promptly and warmly to their child's actions, reinforcing the child's sense of agency. Self recognition. Researchers have focused their studies on the timing and emergence of visual self recognition, specifically infant responses to the mirror images. At just 3 months old, infants show a still image of themselves and one of another baby tend to prefer looking at the other baby. However, by 5 months, if their own image is altered in some way, they show a preference for viewing it, indicating a budding awareness of their own appearance. One widely used method to determine self recognition is the mark test. This involves placing a mark on the infant's face and observing their reaction when they see themselves in a mirror. Self recognition typically appears around 15 months of age, but it isn't consistently reliable until about 24 months. Interestingly, recognition of oneself in photographs occurs several months after mirror recognition. Around the age of 2, toddlers begin to use pronouns like me and I when looking at themselves in the mirror, showing a deeper understanding of their own identity. In the study by Pavellini and colleagues, researchers use videotapes of an experimenter placing stickers on children's heads to examine self-recognition over time. They found that no 2 years old and only 25% of the 3 years old searched for the stickers on themselves after seeing the video, despite recognizing themselves on the tape. In contrast, all 4 years old immediately searched for the sticker, demonstrating a more advanced level of self-awareness. Infants develop self-recognition at different ages. Some researchers suggest that babies with a difficult temperament, those who react strongly in stressful situations, tend to develop a sense of self earlier than other babies. This early self-awareness might help them better manage the intense stimulation they experience. For instance, infants who react more strongly to vaccination at 6 months old are often the ones who show mirror self-recognition by 18 months. Additionally, there is an evidence that secure attachment played a significant role in self-recognition, personal agency, and awareness of physical characteristics. Researchers have found that children who are securely attached have a better understanding of both personal agency and physical characteristics compared to children with other attachment styles. Infants whose relationships with their mothers are characterized by emotional responsiveness tend to show better self recognition. Maltreated and abused children, who are often less securely attached, display later self recognition and respond more negatively to their mirror images. With self recognition comes an increased awareness of the existence and individuality of others. For example, synchronic imitation, where a child mimics the actions of another, and concern for the pain or distress of others are both correlated with mirror self recognition. This growing awareness highlights the interconnectedness of self awareness and social understanding. Developmental changes in self description. Self knowledge unfolds in a very predictable pattern as children grow. By the age of 2, toddlers begin to apply category labels to themselves, such as gender and status. During their preschool years, they start to add physical features, possession, and preferences to their self description. At this stage, objective attributes dominate their self view, but how they describe themselves can be heavily influenced by the way questions are asked. As children enter middle childhood and develop concrete operational thinking, they begin to identify emotion and combine various attributes in their self description. Their self-portraits become more accurate than those of younger children, though they still tend to emphasize the positive aspects. As childhood progresses, social comparison and evaluative components start to appear in their self description, bringing with them a greater risk of negative self awareness. By adolescence, in line with their former operational thoughts, teenagers describe themselves in more abstract and hypothetical terms. They focus on attitude, personality traits, beliefs, and role behaviors. Adolescents also become more aware of conflicting information about themselves and might exhibit false self behavior, intentionally acting in ways that differ from their true selves. As children grow into adolescence, their thinking and self descriptions become more abstract and hypothetical. Unlike in early childhood, where the focus is on physical characteristics and possessions, or in middle and later childhood, where behavioral traits and abilities are emphasized, adolescents start to concern themselves with attitudes, personality attributes, and beliefs about hypothetical situations. For example, an adolescent might say, I hate chemistry. I'm a curious person, or if I meet someone with a different idea, I try to be tolerant. By middle adolescence, the self typically differentiated into more distinct roles. Adolescents might describe themselves differently in various contexts, such in the classroom, at home, and with friends. This description can sometimes involve opposing of conflicting attributes, like being shy in the classroom but outgoing with friends. For the first time, this conflict can cause feelings of confusion and distress. As they move into later adolescence, these opposing characteristics often merge into more complex personality styles. For instance, cheerful and sad might combine into moody. This more nuanced view of the self becomes seen as legitimate and normal. Adolescents also begin to display false self behavior, meaning they can intentionally act in ways that do not reflect their true self when necessary. The limits of self development are not yet truly known, but it appears that the self continues to differentiate and evolve through adolescence and into adulthood.